We've previously looked at skin specimens and how to sample them so we can assess margins. The anatomy gets more interesting when we deal with a full thickness eyelid. As before, the skin surface is blue. At the free margin, we have these schematic eyelashes. The skin is continuous with the conjunctival surface, which I've made pink. If we look at the specimen edge on in a sagittal orientation, we can see that there is skin anteriorly, then subcutaneous tissue, then tarsal plate, which I've made yellow, and then the conjunctiva. As the skin and conjunctiva are both surfaces, these aren't surgical margins that we need to worry about. We're interested in the medial and lateral margins, as well as the inferior or superior margins, depending on whether it's an upper or lower eyelid. My personal preference is to examine the specimen in the sagittal orientation, which is how you usually see cross-sections of the eyelid in textbooks. This way I can directly measure tumour distance to the superior or inferior margin, but not to the lateral or medial margins. Other pathologists may prefer to slice the specimen horizontally. With that approach, they can measure the lateral and medial margins, but not the superior or inferior margin. So this would be horizontal slicing. Where you could measure these margins, but not this margin. My preference is to go for sagittal or vertical slicing, which I will do here. So this specimen is in 6 slices. We have our sagittal appearance with the skin, subcutaneous tissue, tarsus and conjunctiva. We can see that in slices 1 and 6 there is no lesion, but we have a lesion in slices 2, 3, 4, but not 5.